We were a completely different company. We only did mental health services. We were a much, much smaller company, but I'm going to say even back then, 37 years ago, we were a small company, but we were still an awesome company.
I've been affiliated with Horizon since 1979. Horizon, Erie County Mental Health Services Corporation II, was established in 1975. What happened was the county decided that they were going to establish mental health services across the county, and the way they were going to do that was by taking the county and cutting it up into 6 slices called catchment areas. And catchment area 2 was kind of the northeast corridor through the city of Buffalo and the Tonawanda, and that was Mental Health Services Corporation II. Anyway, this Norm Teller was the president and CEO at the time, and they ran into trouble pretty quickly. And Jim Wiggin was working for the county, and he was instructed by the then commissioner to do an investigation of what was going on at Corporation II, and lo and behold, what did Jim do? He took it over. And over the course of the years, Jim worked incrementally to get disconnected from that dependence on county money, and so that we could be independent and we could be creative and we could do different things. He was the driving force and became the mentor to me and to Ann and also to Don and somewhat to Michelle in those early years.
I was 18 years old. I recently was laid off from the town of Tonawanda Highway Department, and a family member encouraged me to apply at Horizon, and I started here as a maintenance staff person. We actually operated out of church basements back then.
There were about 50 people when I started.
We had a strategic planning meeting, and one of our strategic planning goals was that we were going to have a computer on everybody's desk. And we laughed and we were like, yeah, right, that's really going to happen.
This is a jacket given to me by Jim Wiggin. And the reason I was called Computer was because I was the first guy at Horizon to have a computer.
Can you even imagine a world today where there's no computers?
Yeah, I think it was the purchase of our first 2 buildings, our 1370 Niagara Falls Boulevard building and our 3297 Bailey building. So this is the first time that we physically own property. I think that was kind of one of the big key points back then, is purchasing our sites and knowing that we're going to be there long term for the community that we serve.
We always had an entrepreneurial type of spirit, even as a young company.
There were certain signature moments, like when New York State asked us to take over a failed mental health clinic at the Cannellation Center. That's where the initial Hurdle Elmwood Clinic was. Again, we were beginning to be identified by the show in town that could do it. If you ask us to do it, we can do it, and we can do it well.
We're an innovative company willing to take the next step.
We had a drive to be the best, and we always had a reputation for being the best.
We were a non-for-profit that was funded by the county. We went private non-for-profit and broke away from county funding. And really the lines, the catchment lines, kind of faded away, and we were able to service different communities.
When we started doing addiction services, that was huge. We were always this, great mental health company that had lots of varying mental health services, day treatment, continuing day treatment.
But that was when we broke into residential treatment and substance use in a big way, because this was in the days in the 80s when substance abuse and alcohol were 2 different agencies.
That was a big, huge part of the company, and a change in culture.
Jim was a dynamo, a brilliant guy. He was something of a rogue, but he was endearing and charming, but he burnt himself out. So at the age of 47, he had a massive coronary in the morning at his home. We were absolutely stunned. All of a sudden, the senior staff that existed at the time, including Ann and I, were faced with how do we go forward, and the board. Jimmy Smith, who was the CFO at the time, and Ann were appointed by the board to be interim co-CEOs of the company, and the rest of us supported that move because they were in the best position, and Ann ultimately took it from there. And since we had been working together for years already, that set the tone of collaboration and communication and trust.
Horizon Village, opening up inpatient residential, and boy, what a proud moment that was. Something that we talked about, and it seemed like a distant, goal, but when it happened, it was awesome.
So we went from 7 facilities in church basements to roughly about 26 facilities all around Erie, Niagara, and Genesee County.
We began to set the standards. We began to say to them, this is what you ought to do. As an example, when we presented that proposal, which I have in my office, frankly, to be a managed care insurance company. I mean, it's just being outrageous and daring and pushing the system to be more responsive.
We're willing to try, and we're not afraid to fail. Not afraid to fail, I think, is a good thing, because that's about having the courage to put yourself out there. And I think if you have courage to try, oftentimes you succeed.
Our employees are very dedicated, they're passionate, they're motivated, and they truly care about the individuals we serve.
It's our people. The people, they understand where we're going. They're clear about our vision and our mission, and they have passion for the work that we do.
It's been my honor and privilege to work with extremely skilled people who are fun to work with. And Ann has done an unbelievable job of bringing in people who kind of fit with the zeitgeist of the organization and bring their unique talents.
I was given the necessary support, guidance, education, and training to succeed. So I would say that's the biggest kind of takeaway, that the company that we all work for today really provides that effort in educating and training their staff.
Honestly, I'm very proud to say that I work here, and the respect and the admiration that I get as a result of saying that I work at Horizon, it feels good.
It's not only a job for me, it's a spirit. It's people who are my friends. It's being proud on a day-by-day basis of what we do and how well we do it. And I'm astounded by the level of commitment and energy and creativity and commitment to quality care. It just makes you proud. And so I've been honored and blessed to be here.